Hello, it's Dr. Gary Burton coming to you from beautiful sunny Florida, and today we're talking about breast augmentation surgery. This is one of my favorite procedures to do. It's a procedure that we do under general anesthesia. It takes about an hour or so to do, and once the operation's over, you spend about another 45 minutes to an hour with us in recovery, and then you get to go home. Most patients go back to work within 3 to 5 days following the operation, and full regular activity within 5 weeks after the operation. Well, a breast augmentation is usually done by women with very small breasts to begin with, or women with asymmetric breasts, where one breast is slightly larger than the other, or women with a slight breast droop or breast ptosis. For the implants, we have two great options. We have gel-filled implants or saline-filled implant. Both are great options. However, I prefer the gel implants. Gel implants have more of a natural feel to them. They go in pre-filled, and the new cohesive gel, it feels really natural. I love this implant. The saline implant also is a great option. It goes in through a slightly smaller opening because with this implant, we fill it during the operation itself. And looking at the patients post-op, it's really hard to determine by looking whether a woman has a gel implant or a saline implant, but you can tell when you touch or palpate the breast. So with this operation, we have to make 3 big decisions. The first big decision we have to make is what type of implant to use. The second big decision is where to make our incision. And third is where to place the implant. These decisions we will discuss with you, and we will determine what is the best option for you during your initial consultation. For the incision, there are 4 incisions. There's around the nipple areolar complex, over the lower pole of the breast, in the belly button, or in the armpit. So the 2 options in my practice is around the nipple areolar complex or over the lower pole of the breast. The advantage of going around the nipple areolar complex is that some ladies will have a big pigmentation change from the areola itself to the surrounding breast skin, and you can hide the incision in that pigmentation step-off. So the disadvantage of this incision is that there are milk ducts around the areola, and when you cut into that, you potentially can contaminate the implant. This can lead to an increased chance of a capsular contraction. So my go-to incision now is over the lower pole of the breast. We keep this incision fairly short, and with a good closure, we usually can achieve a thin line scar. So the next decision we have to make is where are we going to place this implant? We have the option of placing it on top of the muscle or underneath the muscle. And in my practice, the vast majority of the time, we're going to place it underneath the muscle. By placing it underneath the muscle, we get less implant show and we get more of a natural teardrop result. In addition to the type of implant that we select, we also have to select the size of the implant. These implants come in a variety of sizes. We have to select the profile. They usually come in a very low profile, a moderate profile, or a high profile. Depending on your body type and shape, that will determine what profile is best for you. And also these implants come in a variety of different shapes as well. With this operation, and for any operation, complications can and do happen. With this operation, the 2 complications I fear the most are localized infection and capsular contraction. To minimize this, we're going to give you IV antibiotics prior to the incision. We're going to keep you on oral antibiotics for several days following the operation. And to minimize the chance of a capsular contraction, I'm going to usually suggest that we go with a gel implant. And during the operation itself, I'm going to use a no-touch technique using an insertion funnel to minimize contamination of this implant. Also, I'm going to soak this implant in betadine prior to insertion to minimize the chance of you forming a capsular contraction. So breast augmentation is one of my favorite operations to do. It's a very safe operation with very predictable outcomes. If you're interested in breast augmentation, give me a call. Hope to see you on the next video.